Well, amid rising COVID numbers across New York State, Governor Hochul says now is the time to act before the situation gets worse.
So starting today, indoor public places throughout the state that do not require proof of vaccination will require you to wear a mask or face a fine. And many hospitals across the state have had to limit elective surgeries. That's because they do not have enough free hospital beds.
Joining us this morning, Chief Quality Officer for Northwell Health, Dr. Mark Jarrett. Nice to have you back on Good Day New York.
Good morning. Thank you for having me back.
So, Dr. Jarrett, get us up to speed. What do the hospitals on Long Island look like right now?
Right now, we're at pretty full capacity. We are not stretched the way they are up in upstate New York. And in fact, Northwell is sending a group of about 20 nurses and other staff up to the upper state out west, Erie County, to help the staffing. But the numbers keep increasing.
So are these all COVID cases?
Well, we're faced with two things. One, this is getting to the cold weather, so we get flu and other viruses, pneumonia, plus the number of COVID cases have increased. We probably have double the number of people in the hospital with COVID that we did, let's say, a month ago.
I was looking at some of the numbers on the nyc.gov website, Dr. Jarrett. Just for the 7-day average in New York City as of last week, it was 51 hospitalizations. But as the week of October 17th, it was 128. So why implement these mandates now when more people are vaccinated now? And we're seeing that initial report about Omicron as it being less severe.
Well, first of all, the initial reports on Omicron are what we hope it will be. We still don't know for sure when it's out in a large population, infecting huge numbers of people. Again, the issue really is about the masking. Is it will cut down on transmission. It will also actually cut down transmission of flu, and flu vaccination rates, unfortunately, this season are very low. And therefore will prevent this being an overload situation for the hospitals. There is good evidence that when the hospitals are full of COVID patients, that regular care suffers. People do not go in for care. We have to cancel elective surgeries. And what's the definition of elective? Goes beyond somebody getting plastic surgery. It's things that really should be done, but not are emergencies. So anything we could do to reduce the number of cases will be helpful. Even if it's a small reduction, it will be helpful. And I think we just have to forget about the word mandate and just say this is a good practice at this point in time, especially since we're all going to be getting together with families, et cetera, that, that we try and be as protective as we can of ourselves, our family members, and the general population.
Well, unfortunately, the governor is using the word mandate in this situation, and maybe that's a fortunate thing, as you are explaining, that this could help reduce the number of hospitalizations in a lot of cases. However, there are some Republican county executives that are saying, we're not going to enforce this, and that's the reasoning behind that is they're saying that they're not going to take people from, one part of the sector that are vaccinating kids and adults and move them over towards checking to see if places are masking up or not. What do you say to that argument?
I think, unfortunately, this whole issue has become extremely political. If we all sat back and threw the politics out, threw the word mandated, required, et cetera, and just people thought about doing what's the right logical thing to do, I think we would have probably 95% compliance to begin with. And I think that at this point, we have to be careful. We cannot have the hospitals overloaded as we see in upstate New York. That's a very dangerous situation. So if we can do anything to reduce that, as unpalatable as it may be to some people, it may be worth doing. It may not be a cure-all for everything, but again, a small reduction could be just enough to keep hospitals functioning at their optimal level so that patients with all conditions get the best of care.
What are you seeing on the booster shot? Is it working?
The evidence is that the booster shot does work. It does not prevent you from getting another infection, but it appears to be much milder. It's much less likely that you will wind up in the hospital, and extremely unlikely you'll wind up on a ventilator. The people who do have boosters are people who usually have multiple other medical conditions that leave them prone to getting complications from COVID or other infections, and no matter what we do in terms of immunizing them, may not always help. But for the average person, especially the average older person, there is no doubt that boosters help.
All right, vax or mask, Dr. Jarrett?
I think you have to vax or mask and maybe do both.
There you go. Okay. Thank you so much, and we appreciate all the people who work at Northwell Hospitals for keeping us safe. We appreciate them.
Thank you very much. We have a great team.